Good afternoon and welcome to Ask the Expert with Dr. Walter Tom of Dr. Tom Cosmetic Surgery. Dr. Tom has offices in Santa Rosa, Napa, and Maui. You can also find him online at drtomcosmetic.com. That's drtomcosmetic.com. You can also call for a free consultation at 707-542-8346. Dr. Tom has been voted by you Best Cosmetic Surgeon for 8 years and his team Best Aesthetician for 3 years by Press Democrat readers. And hoping for three-peat and, 9-peat? I don't know. 4-peat? I don't know. We're going to come up with some more of them. I'm sure of it. Dr. Tom and Karina Lozano are here. Karina is the surgical liaison at Dr. Tom's office. And today we're going to be talking about breast lifts and reductions.
We are, but... So I have to, this is actually hot off the press.
Hot off the presses.
Hot off the press. Should we tell her?
Oh, sure.
What should we tell her? Do you know what I'm talking about, Karina?
Yeah, I do. Yeah.
Okay, let's announce it.
Go ahead, you get
Oh, I get to announce it. So we just found out we're not supposed to actually release it, but we're doing it right now on KSRO. Okay, news break here.
Exactly.
Okay, is that thank you everybody out there, our listeners. We always want to thank you, and to our family and my mom. I'm sure she voted for me. We actually won for the 9th year in a row.
You did.
Yeah, yay!
Yay.
For Best Cosmetic Surgery. I like to say surgery because I like to include the team.
Yeah.
With that for Sonoma County, and so that's our 9th year in a row. And we also won for Best Aesthetician, our Hillary Booker, who's our medical esthetician. We just won for the 3rd out of 4 years of Best Esthetician. So thank you, everybody.
Wow, congratulations.
Thank you. So that's great. And we have Karina. Welcome back, Karina.
Yeah, thank you.
And we have Karina, and those of you who have been kind enough to listen to us every week, you know that Karina is becoming kind of a regular here with us. Karina runs my life for me. She takes care of me in the office. You do. You run my life for me. I think she's the boss now.
No.
And Karina, we hired as a medical assistant, and she segued into surgical tech and assisting, and now is our surgical liaison. So she is the first person, and she is the voice and first smile that you will encounter at our office if you're interested in cosmetic surgery. And in the background, and I'm just going to mention her name, we have a nursing student, Bella. She's not going to be on camera with us, and we are going to be featured on YouTube. So if you want to hear a recast of this of our show today, just go on to YouTube. Bella is a pre-nursing student at Gonzaga, and we're hoping maybe someday she'll come back and join us at the Dr. Tom Cosmetic Surgery. So welcome Karina specifically.
Thank you. Yeah.
And so today we wanted to talk about a procedure that is in great demand at our office. I think it's actually probably becoming our #1 surgery, and that is breast lifts. And interesting that although it's really neck and neck, breast augmentation, and most people think of that with breast implants, although we can use fat to augment the breast, and that's a topic for another show. But it's really women who want to have a breast lift, and then a secondary to that may be a breast lift with a reduction in size, and that has really become our neck and neck with breast augmentation, the 2 surgeries that we perform the most. So, Karina, you are our surgical liaison, and so can you just give us a short synopsis? What does that mean as our surgical liaison?
Yeah, I'd be the first point of contact when someone wants to inquire about a surgery, any questions about pricing, any just in general questions about surgical related things. Then you would call the office and they'd send you over my way.
They send you your way. And so, it's always hard. Everybody's busy, and we really respect your time as patients. And so what we'll do is we'll actually set up a consultation time with Karina so that you know that if I call on Friday at 2 p.m., Karina is going to be available to talk to me.
Right.
And how much time do you set aside to talk to our patients?
It's about 30 minutes, but it can sometimes take longer than 30 minutes.
I suspect that it's 30 to 45 minutes more likely that you actually spend so much time educating the patient. So specifically, let's jump into our topic. Women who want a breast lift, okay? Tell me a little bit about kind of the typical patient who might be calling you, and what are their concerns, or what do they request?
Yeah, so there's a few different patients who would call. Some don't even know they need a breast lift, or that's what they want. They kind of are just, I think I need something done. But, would be a mom Usually a mom who's had kids and they breastfed, and now they're noticing the changes that happens with creating a beautiful life.
Okay. Yeah.
That, and then women who have had implants in for a long time, and maybe they went bigger initially when they were younger in their 20s, and now they're in their 40s or 50s, and they might notice that their implants aren't as perky, or they're not where they used to be, and may even want to be a little bit smaller.
And that does happen often,
Yes.
actually, where somebody in their early years, they decide on a particular size that makes them happy, makes them more confident in terms of what we call primary breast augmentation with implants. And then after a few decades, their life changes,
Right.
and they want to go smaller, so they contact us. Is there any other subgroups? So you're talking about moms may
Yes.
call, and about women who maybe have had breast augmentation, and now
Right.
maybe their breasts have fallen, they're not as perky as
Yeah.
they used to be. Anyone
Yeah,
else?
anybody who's gone over a dramatic weight loss.
Right.
Weight loss, and that comes with, laxity of skin, maybe their breasts aren't as big as they used to be, all those things. And then people who just, maybe they were really big breasted and they've always been bigger chested, and maybe they want a reduction, they want to be smaller, but most of the time we need to lift them up as well.
Lift them up as
Yeah.
well, and that's actually a great point. So, and when we're going to cover breast reduction, okay,
Right.
in the second part of our show, remind me. I'll tell you a little story how I had the epiphany and how I was actually educated by a patient. I had my own misconceptions as to women who might want to have a breast reduction. So let's talk about the patient who calls in and they're concerned about their breast. Does anyone ever call and just say, I know I need a lift?
Yeah, we do get those patients who say, I want them lifted.
They know that
Yes,
they're low.
they
And
know.
what kind of comments do they make in terms of how it makes them feel, where their breasts are sagging, or the status of their breast, if
Yeah,
you will?
just fitting better in clothes, or their bras aren't giving them enough support. Maybe they want to wear a dress for a special occasion and they want to go braless, and that is holding them back from
Right.
doing that.
Interesting. And so Karina is a wonderful liaison, and she is able to relate to people of all ages, even though she's a Gen Zer, okay? And I love it. The one thing that she didn't mention, and maybe I get that because I'm a little bit older, and so the patients kind of respond to me differently, as we do to each individual, is that I'll get patients who the complaints will be a little different, and they'll say, my breasts are sagging, and it doesn't make them feel very confident. It affects their self-confidence. They feel that they have to kind of lift their breasts up in order to put them in a bra, okay? They will tell me that they will not get disrobed in front of their partner, their spouse or their partner. They're so self-conscious about that. Or maybe when they're laying down and their breasts fall under their arm. We call it the axilla, but it falls what lay people would call the armpit if they feel like the breast is falling off their
Right.
chest. And so that's very bothersome for them. So I see a lot of those kind of patients who will come and talk to us. And one of the aspects, Karina, and I know because you're a surgical tech and the beauty of having Karina be part of our team is not only is she talking to you at the onset with your intake phone call, we call it, she will be there and you set up then a virtual consultation with me, then you'll come in for an actual in-office exam and further discussion. So we educate and create a relationship with you. It's really important to us. Karina's there the whole time. And Karina, one of the comments that I'll make to the patients, because sometimes they don't know how to verbalize it, is that they feel less feminine. I'll ask them, and they'll say, the way that I word that is, I'll say, many of the patients have related to me that they feel less feminine, and it's because the breast is hanging over their rib cage,
Right.
okay? They feel like they can't even see their upper portion of their abdomen because of the way that the breast is hanging down, and that's bothersome for them. Okay, so we set them up for a consultation with me, and we see if if they're a good
Right.
candidate or not. Let's say then I meet with them, and we'll kind of skip through my consultation, and we, along with the patient, not myself, decide that they're a good candidate to have a breast lift. What would be the next step for them then?
We'd book surgery. Yeah,
lipo surgery?
if they wanted to and
Okay.
they thought it was a good fit, we're a good fit, they're excited about it, they want to do a lift, then we would book surgery.
Okay. So I'm going to throw you a little bit of we didn't talk about this beforehand. Like, what are we going to talk about on the show? So what about the patients who decide not to do a lift? What do you think their biggest objection is to having a lift?
For the, it could be the cost, that can be one, but most of the time it's the fear of scarring, or the downtime and
Right.
the discomfort.
Okay.
So that is the biggest.
Right.
I would think, and when they say, oh, I'm not ready, I'm not sure about the scarring.
Okay. So let's talk about
yeah.
that. Okay. So I'm a surgeon. I was a general vascular transplant surgeon. I like technical things, and so I love to do the technical aspects of a breast lift. However, I tend to think that it's done too often, and I feel that a lot of women, we have to educate them. They think their breasts are supposed to be sitting up high on their chest, and they look at various magazines, brassiere magazines, so you know which one I'm talking about. Initial start with the VS, okay, is that that's where their breasts are. And so I have, and Karina, you've seen that, I have a photo actually of one of the very first models for that particular company, and it was a beautifully artistic done photo of her with body paint on, so you're not seeing her, everything naked, but she's painted out. But what's nice is you get to see where her breasts are hanging naturally. And then what I do is I then show in my next slide to our potential patients what she looks like on the runway when she's in the kind of the skimpy outfits. And it's really the bras that create that look where it looks like you could put a drink on top of the, there's a shelf on the top of the woman's chest, okay? And so really it's the bra. So part of it is educating them. And so especially, and it tends to be a little bit younger women are a little bit too critical of themselves where they think, oh, my breasts are a little bit low, I really want them up here. I actually try to steer them away from breast lifts because I don't think that the procedure and the incisions, if you will, that are required to do a breast lift are worth the result. So let's talk about that for a minute, Karina. So, we do our procedures under local, and that's great. So you mentioned downtime. I'm going to say in terms of if you do desk work, you could probably be back to work in 5 to 7 days, okay? If you do more physical things, it might be a week or two. One of the biggest things would be is that even though you can probably get into aerobics after a couple of weeks in terms of weight training of your upper body, I'm gonna say 3 to 4 weeks. And the biggest thing is that I don't want you in public waters meaning hot tubs, swimming pools, the lake, the river, the ocean for about a month, okay? And those are really the major restrictions. But in terms of when can I drive again and all, probably after a week or so you can drive, and you're getting back to kind of normal activity, but get somebody there to help you with your recovery, and that's with both a breast lift as well as a breast lift and a reduction. But when we go over then the concept of what's done, basically what we're doing is removing excess skin on the lower half of the breast, and we're bringing it together. So it's kind of pinching the breast tissue upwards, or what we call superiorly in medical terms, or towards the head. And so we remove that excess skin and we suture it back together again. So we're kind of making a bra out of your skin, right? Okay. And so that's what's there. So I find what subset of patients do you think are the happiest who have breast lifts with us?
Women with significant amount of
exactly.
drooping of the
Drooping.
breast,
We call it ptosis, but drooping of the breast, sagging of the breast. And I had one, and our patients, I love them, and some of them can be very endearing and funny. I had one patient, and she was, I think, maybe in her late 40s or early 50s, and her comment was that she thought that her breasts were racing to her belly button, okay? And that made Michelle, who's our producer, laugh a little bit over there in the background. But that's how she described it, and I know that, even though she joked about it, that's how she felt, like her breasts are just racing down to her belly button. Those patients understand they're the ones who more so are afraid to get disrobed in front of their partner because of the lack of confidence and so forth. And so those are the ones who are willing to trade surgical incisions, okay, which are scars, obviously. They all usually tend to look actually really good at about a year. I think they look great, okay? But that's the big fear. And so we try to explain that to our patients. But those subset of patients love having a breast lift. Okay. So, we go ahead and I would agree. Oh, we have a question from
Yeah,
Michelle.
I just want to ask, do you have any pictures, like anonymous pictures, to show your patients what it looks like, sort of like after a year of healing, so that they get an idea of sort of generally what it looks like after you've recovered?
So let's talk, we're going to answer that question for you, but
Okay.
Karina, so, somebody, when they call you on the phone consultation, is there anything that you request to help us to know how to guide them initially?
Yes, we do ask for pictures with no identifying, so no face, from the neck down and waist up for you to review prior to the procedure.
Okay, and how many views do we usually ask them to try to
We
send
usually
for us?
like a front facing, a left side view, and a right side view.
Correct.
Which, it can, if someone is around to help you, they can
That's
help
better to
take
have someone else
your-
take the photos,
Yeah,
right?
take the photos of you. But if not, selfie mode works.
Absolutely.
You just gotta prop
Okay.
up your phone.
Okay, so as we mentioned, so we do get those photos, so we can tell a patient, somebody may say, I think I need a lift, and we'll have Karina set up the consultation with me, and she may say, Dr. Tom doesn't think you need a lift, and that's great. Or, unfortunately, where somebody thinks they only want an augmentation,
Right.
but their breasts are hanging down over the rib cage, Karina will call and say, Dr. Tom will talk to you about it, but he's thinking that you're going to need a lift. Okay, so we do that. And then, Michelle, you asked us about, are there photos? We have great patients, and we protect their anonymity. The toughest ones are when they have an obvious tattoo, which is really showing, and I get a great result, and it says, it has a tattoo, so they usually don't want to share their photos. But most of our patients are more than happy because they're so happy with the results, and they know how important it was for them to see before and after photos, that we have a lot of photos, and they're all my patients, and so patients can see that. And then I specifically show them what the incision's like, and sometimes I'll show them right after surgery, 2 weeks out, 2 months out, 6 months out, so that you get a really educated idea as to what goes on. So we will then proceed with the breast lift for those patients, okay? And the procedure we do under local, right?
Right.
Okay, and then what is the follow-up for those patients?
No, we'd like to see them the next day, 2 weeks, and then a 2-month appointment. If there's things that are happening, then you can see us at any point. You don't have to wait until your appointment.
Right.
Yeah.
So Karina, you spend a lot of time talking to the patients, and sometimes we give them so much information, most
Yes.
of us, like we know when we're in school, how much do we retain from a lecture, right? A little bit, and that's why I had to read things over 1 million times
Right.
throughout my years as a student. What would you say are the key points that you wish patients would definitely retain when they have the procedure in terms of expectations afterwards, their post-op care? Post-op self-care.
Post-op self-care. Okay, so really resting. Really taking the time to let yourself rest. Most of the time, breast lift patients, they feel really great. Yeah, they feel great. I feel good. I'm not in pain. And then they want to go do all these things. But if you just let your body heal and give it time to do what it needs to do, then your longer results, you'll feel better a month out.
Absolutely. Karina, that's the way we all are. I know that's the way that I am. I had a hip replacement surgery, and I wanted to be doing things, and I specifically, I know I booked it so I would not be in the office. How many days after my surgery was I in the office?
It's like day 3.
Yeah,
and you were in
exactly.
there.
Okay, so doctor, heal thyself. I'm just as guilty, but I didn't do any surgeries and I didn't do any treatments, but I was just in there bugging the staff. Poor Karina. And so really is taking the time, and you can do yourself a disfavor by trying to return back to things too soon. And what I tell patients, and hopefully they listen, is that if you take your time, follow the post-op directions, and allow yourself to heal, your recovery will be actually much quicker than if you push yourself to do things prematurely.
Right.
Okay.
Yeah.
All right, so we have, it looks like about 7 minutes or so that we have left in our show. So Karina, let's talk a little bit about women who want a reduction, okay? And so I should backtrack. We kind of jump around a little bit here. So the subset of women who want to have a lift are, we talked about maybe their breasts are bigger and they want to have them lifted. Usually it's related primarily, number one, to pregnancy and the enlargement of the breast. It can be due to weight gain and then immediate weight loss. And then sometimes just genetically, and that's what we were taking care of yesterday, some women, that's just how they develop as soon as the breasts begin to grow, where they're just sort of pointing downwards. And so we definitely want to help those young ladies with their kind of concern. What is the typical patient who wants a breast reduction?
Yeah, so it varies, but it's always that woman that had really big breasts, whether they're a tiny frame or a larger frame, and it hurts their neck, it hurts their back. They can't find things that properly fit because maybe they're a size small and they're bikini bottoms, but their chest is a large because they have breasts that are larger. So that would be someone who.
That's it. Okay. Yeah. And so it's interesting to remind me about a story. So I was speaking with a young lady, and we were just we're having lunch, and she was telling me, we were in a professional organization together, and she was telling me about the fact that she had a reduction in lift. And at that time, and for those who don't know, I was a previous general vascular surgeon before I became a cosmetic surgeon. And so I dealt about a third of my practices with breast cancer. And that's where I was. And in fact, if you would have told me when I came to start the kidney transplant program at Memorial Hospital when I was 32 that I was going to become a cosmetic surgeon, I would have told you were crazy, that I didn't even believe in it, okay? And look at me now. So things change, life changes. We talk about that. And part of my epiphany was, as I spoke to this woman, when she told me that, I said to her, we'll call her Svetlana, that wasn't her name, but I said, Svetlana, why would you have an operation if you didn't need it, right? Because I was talking to patients about operations, risks, and so forth. And she kind of put her hand on me, sort of saying, like, you have no idea, okay? She said, you don't know what it's like to have it be so heavy that your back or your neck hurts. You have no idea what it feels like to be, and I remember this word for word, you're laying down and you have to take your right hand and reach over and grab your left breast and pull it up onto your chest and do the other in order to get up, okay? And it really struck me, and what it showed me was how I was actually being judgmental, okay? That I wasn't trying to be mean, but in my head I'm thinking, like, why would you do an operation if you didn't need it, right? And she was showing me both physical as well as the emotional aspects of wanting to have a reduction and have a lift. And that was very eye-opening for me, and I need to, I haven't seen her in decades, but I need to, if I ever see her, I'll relate to her the story and how it really helped with my epiphany in terms of how we can help patients. It's not just taking out a gallbladder or putting in a transplanted kidney. We can help patients in many different ways, and one of them is a reduction and a lift, okay? So if somebody says, I want a reduction, what ways can we do that?
Well, it's a two-parter. So, we can remove some of that tissue with liposuction. Okay. Sometimes you opt to physically remove or extract some of the breast tissue if there is a lot. And then the lifting, it's a combination. Okay. They wouldn't be happy if we just took all the fat out.
Right.
And
so
just left their breast alone.
That's key. Can you repeat that part about they wouldn't be happy if what?
We just took all of the breast fat out and then just left the breast alone.
Right. Yeah. So if we just remove breast, and a lot of times I'll ask the patient when they're looking at themselves, how much smaller do you want to be? Just guesstimating. If you look at yourself and that's 100% what your breast is, do you want to be 20% smaller, 30% smaller, 50% smaller? And it gives me an idea of what you want. But if you reduce the volume in your breast, what's going to happen to the breast?
It just hangs more.
They're going to even sag more, significantly more. So we can reduce the tissue, as you mentioned, either through liposuction or through actually removing some glandular tissue. The breast is made up, depending on the age, of glandular tissue and fat. So if you are overweight, there's going to be a little bit more fat. If you're a little bit older, because your glandular tissue decreases as you get older, you're going to have more fat. Probably the younger patient's going to have more glandular tissue. And we take care of patients in their 20s and even, believe it or not, in their 70s plus. who have these concerns, and
Mm-hmm.
they love the fact that they fit better in their clothes.
Right.
That's number one. And again, it goes back to just confidence.
Right.
It goes back just to self-confidence. Karina, have you seen me sometimes when the patient's in the exam room and we're looking on the in a mirror, and I'll just say, now I just want you to take your own breasts and I want you to lift them up to the position you think they should be.
Mm-hmm.
What impression do they get when they're looking in the mirror? Do you know what
They
I'm
look
talking?
slimmer.
They absolutely look slimmer. The breast hanging down over their rib cage makes them look more matronly. Okay, and we even say a lot of times in Latinas, you want to look like Mamacita, not Mama,
Right.
And so by just lifting the breast off the rib cage, it gives them a more youthful look. And in particular for women who are big-breasted and want a reduction, it is a dramatic change in how they view themselves.
Mhm.
Right?
Yeah.
Yeah, and so they're a great patient. Is there anything else that you would like to leave our listening audience in terms of lists, reductions, or anything like that? Anything you want to leave parting with them?
No, just if there's questions, they can always give us a call, and it's different for everybody, so their case may be completely different. So,
Absolutely.
yeah.
Karina, thank you for coming
Yeah,
on.
of
I think our
course.
time's up. I'm going to
Thank
turn
you.
it back over to Michelle. Thank you, everybody, for listening and for voting us once again Best Cosmetic Surgeon and Aesthetician in Sonoma County.
Wow, this is really great. I love the very informative and compassionate way that you talk about this procedure, because it is so important to so many people for their self-esteem and how they feel about
It
themselves.
is.
So yes, if this is something, and usually this is something that women think about for a long time before they actually call, but don't be afraid. You can have the consultation, learn more about it. So be sure to give Dr. Tom a call for a free consultation at 707-542-8346, 707-542-8346. You can also check him out online at drtomcosmetic.com. This is KSRO.